The take. Now, as we've heard already on the programme, the government's releasing an app to try and warn people if they've been near someone who reports symptoms of coronavirus. But there are questions about technical issues and worries over privacy. Some people want their data kept out of the government's hands. Michael Veal is a lecturer at UCL who's working on a rival project to the government, and he joins us now. Thank you very much for being with us. Now, we know, of course, that this NHS app is going to be really central to the government's plans for easing the lockdown. How important do you think it will be, and how do you think the development's going?
So the development appears to be running into some problems with different types of phones. So when we're developing a system, we're developing the system for Germany and Switzerland and Austria and many other European countries. We've been working in a way where all of the matching between people happens on a user's device, not in a central server. And that's generally considered to be more privacy preserving. Whereas the UK has taken a different approach, which builds a social network of people in the cloud. The problem is that Apple and Google, Apple in particular, have stated that they won't allow this kind of central system to be created. It doesn't work with their operating system. And so the UK is really going against the grain and therefore is finding problems on both Google and Apple phones as a result.
Do you think it's right, though, that companies like Apple and Google should be able to effectively dictate the UK's government response to a pandemic?
Well, the question is, no app was possible beforehand. Basically, Bluetooth is commonly used to track people around shopping malls or supermarkets, and so it's often disabled by default in the background of a phone, so it can't be used when the app is off. And Apple and Google had to produce a response that met all countries' needs at once. In particular, it had to produce a response where countries, potentially like Hungary, which were lacking rule of law in many ways, couldn't abuse their own phones. And so they had to propose a system that worked for every country at once. And that was a system that that limits what governments can do and build with that data in ways that can harm citizens.
We spoke to Robert Jenrick a little earlier about this. He said that the trial's going well in the Isle of Wight, but of course we also discussed this idea that a second app is being developed just in case. Do you think the government will end up using the second app?
Yeah, there are real signs that they might, particularly because the UK is a clear outlier internationally in using this particular type of approach. And that means it won't work well across borders. The Republic of Ireland have already said they're using a decentralized approach, and that will potentially create problems there if the devolved administration chooses to effectively put in this kind of app. And so there are challenges there also with it functioning in the first place, and public acceptance, because the problem with the UK's app is that it creates a foundation for building more and more on. If this app doesn't work, or if the government wants to build, say, immunity risk scores, or stop people coming into pubs or shops or going to work without this app, it's unclear that this protects against it. And there aren't clear legal safeguards, like there have been passed in Australia instead, to say nobody can demand you show this app to anybody else.
Realistically, when do you think this kind of app is going to be up and running in the UK?
I think it wouldn't be any time before June, but again, it really depends on how the trial's going. One of the challenges is the app needs to be tested in realistic situations, busy situations. And if the Isle of Wight is in lockdown as it is, it's unclear that that is a good testing environment to see if the app really works, particularly around issues like battery when there are a lot of people around, and it just functioning at all and continuing to work throughout the day, which is not a problem the Apple and Google-based systems have, but is a problem that the UK system is facing.
I also wonder as well, do you think it could just get completely overwhelmed if people are reporting symptoms and then the alert goes out, or you might even get some people reporting false symptoms? Could you just see everyone ending up having an alert and being in lockdown?
That's definitely a type of risk. The UK is also an outlier in being effectively the only country to use self-reporting in this app, not verified tests. That appears to stem from not a lack of number of tests potentially, but really something that hasn't been focused on enough. The tests aren't fast enough in the UK compared to other countries. And so the UK seems to claim it's stuck using self-reporting because it can't get a test turned around within a few hours. And this is really a worry, but it's in the other countries we're working with, they are very clear that self-reporting will not be allowed on their app because it can be misused or used for pranks or used to target people deliberately and put them into quarantine without them knowing.
Interesting stuff. Thank you very much for coming on and explaining all that, Michael Veal.